Time once again for a look at what's making headlines in the field of heart health. Seconds count in medical emergencies, and healthcare providers are doing everything they can to improve outcomes for people heading to emergency rooms. That includes new technology being used in ambulances. Joining me to tell us more is Dr. Stanley Thompson, Medical Director of the Emergency Department at Baptist Memorial Hospital DeSoto. Welcome to Smart Medicine's Heart of the Matter, Dr. Thompson.
Thank you. Glad to be here.
Doctor, we have some questions for you about response times and emergency rooms in cardiac medicine. On average, how do Baptist DeSoto's cardiac emergency response times compare with national benchmarks?
Actually, national benchmarks, Joe, is about 90 minutes. The goal you want to shoot for is a patient get to your door and to be in the cath lab with that artery that's closed from the heart attack being open within 90 minutes. And at Baptist DeSoto, with the help of our cardiologists and our ambulance service and the hard work done in the emergency department, we've been able to beat that benchmark by about 30 minutes. We're averaging about 52 minutes from door to that artery being open.
This is truly the ultimate team sport, isn't it?
Oh, yeah, it is. It involves everybody. And that's how we struggle. We want to get, when we weren't making those numbers early on, 5-6 years ago, our problem was we didn't have everybody at the table and everybody really doing their part. But now we have the emergency department, the excellent cardiologists that we have at Baptist DeSoto, as well as South Haven, DeSoto County EMS services, all involved in the care of the heart patient.
Let me ask you this. Please describe for us what happens after you first get the call that a cardiac emergency patient is coming to your hospital.
Well, they give us a call, let us know that they have a patient in the field that's highly suspicious of having a cardiac emergency, a heart attack. And one of the main things we use to screen those patients is the EKG. And those patients who go directly to the cath lab are those who have certain findings on that EKG. Until a doctor sees that EKG, he can't call the cardiologist and the cath lab and those things to get mobilized. But now we have the technology with South Haven EMS and DeSoto County EMS, where when they have that suspicion and see that EKG, they're able to transmit that EKG to the hospital. So while they're en route and providing ambulance care en route, we're able to start getting the cath lab team in, getting the cardiologist en route, no matter what time of day or night it is.
Mm-hmm. It sounds like the paramedics are key players in all of this. How are they prepared to respond?
Well, what we've done is, it took some time to get the technology on all ambulances as well as the technology in the hospital, and then we've done some training as well, of course, their core training as EMS providers, core training to recognize the types of patients that could be suspicious and how to recognize those findings on the EKG so they can transmit it forward. So there's been a lot of preparation done on the EMS part.
All right. Well, Dr. Stanley Thompson, thank you so much for these insights.
You're welcome.